Good evening, and welcome to tonight's webinar on dynamic dentistry. I'm Dr. John Camisi. I'm a general dentist in Ithaca, New York, and a member of many different groups, speaking around the country and writing in various publications. I'm really glad you can make it this evening. We're going to talk about the oral environment and the need for dynamic materials. Tonight I'm going to take you on a journey. For many of you, I'm going to take you outside of your comfort zone and take you to where the magic happens. In my office, the magic happens in the working and how we deal with the various peoples that come into us for assistance on trying to control their disease entity that they have in their oral cavities. And tonight I'm going to share with you some of my concepts and some of the materials and methodologies that we're using that I think you'll find very helpful in what you do day to day. First of all, let's talk about and think about saliva. Think about it as a bloodstream within the oral cavity. It builds and maintains the health of the soft and hard tissues that it comes in contact with every day. It removes the waste and contains proteins that fight the disease entities. And it offers essentially the first line of protection against microbial invasion. It's the mouth's primary defense mechanism against caries. It enhances the protection of the enamel by providing the high concentration of calcium and phosphate ions to the tooth surface. And along with the proline-rich proteins in the saliva, the calcium and the phosphates help to prevent the precipitation of calculus. When everything is in balance and the appropriate proteins are present, calculus formation doesn't occur. It's when things are out of balance that we have to worry about that and deal with that on a day-to-day basis. Saliva is a protection for the enamel, and in fact scientists think that saliva is some sort of a form of liquid enamel because of its high concentrations of the calcium and phosphates. These minerals maintain the integrity of the enamel surface and are the major agents in preventing caries. Along when you also have some small amounts of fluoride present in the tooth surface, that enhances the saliva's ability to protect and maintain the enamel. However, saliva has been considered an enemy in the restorative process, and that's because we've been working with, to date, materials that were created that cannot work in or with saliva, and that's an absolute shame, because if we had materials that could work with the oral environment, what a great thing that can be. And luckily for us, there are quite a few different materials that you and I can use every day to help our patients, and we're going to talk about that tonight. Dr. McCabe, back in 2011, first published this article regarding the passive nature of dental materials and how they are relatively neutral in their ability and what they do in the oral cavity. They're biocompatible and cause no harm or injury to the tooth surface, which is fine from the perspective of what we're doing as far as trying to fill the hole in the tooth. But in my opinion, and in Dr. McCabe's, it hides the possibility of having an active and dynamic environment that can deal with the onslaught of acidic nature and the bacteria and the other ravages of dental caries. In my opinion and in Dr. McCabe's, there's a need for materials with a smart behavior. Over the recent years, nanotechnology has become a very important part of our restorative material process. And of course, these are materials that are from 0.1 to 100 nanometers in diameter and are types of nanorods and fibers and spheres and tubes, and interestingly, ulmer-sears, which are organically modified ceramics. These materials improve the physical properties by increasing the strength, the polishability, the wear resistance, aesthetics, and even bond strengths. Their inclusion into our material resins creates a more biomimetic, lifelike restoration and enables the materials to mimic the physical characteristics of the surrounding tooth structure and can even help facilitate the remineralization of that structure. In Advances in Dental Research, it talks about, in this article by Hanning, that nanotechnology and its role in caries therapy. And the interesting part is this nanotechnology and these materials can help with the remineralization of the initial caries lesions, and they have a caries preventive capability by being very biomimetic in their synthesis of enamel repair of the carious lesion when with the enamel-like materials and these nanomaterials. These bioactive materials, I've coined the phrase a while back for proactive dentistry, considering that these bioactive materials can have these smart behavior because they have the capacity to interact with the living tissue and systems of the oral cavity, and they can react to the various changes in the environment to bring about advantageous changes in properties, either within the material itself or in the material tooth complex. And that's the exciting part. And this is all inspired by how nature actually works. These materials are able to also maintain their physical properties while allowing these bioactive nanoparticles to be released from these zones when they are needed by the dentition. So basically, on the left-hand side of the screen, we can see water and saliva flowing through the overall resin matrix structure present, and it can then release the fluoride and other ions within the resin matrix to bind with the calcium of the tooth structure and to help it become more caries resistant and remineralize. They provide stress-bearing mechanical properties combined with the caries inhibiting capacities because of the release of the calcium, the fluoride, the phosphates, and enable this modern restorative type of material to be very successful in our day-to-day works. Let's get to the bottom of it all. The tooth is alive. It's constantly being and dealing with what we do to it. Every time we eat and or drink, there's a change going on, and the dentition have to respond to that change. They essentially live in a biologic soup. And Chow and Vogel back in 2001 showed us that the enamel is actually a semi-permeable membrane with a constant flow of fluids outward from the pulp. These fluids will help to combat the acidic activities that go on. And in fact, it's also been shown in some aspects that the teeth can actually kind of sweat. And that's an interesting concept that is very, very remarkable. The remineralization process, of course, is the foundation of what we do in prevention and non-surgical therapy, but it's a complex process which is influenced by the anatomy and physiology of the teeth, the quantity and, of course, the quality of saliva, and the constant fluctuations in the pH of the biofilm that inhabits the oral cavity. Dr. Kim Couch coined and talked about in this great article in Compendium last year about saliva. And if saliva were unsaturated, he stated, with respect to appetite, the teeth would simply dissolve. That's a very key and important aspect to think about. The mineralization and the health of the oral cavity is dependent on a healthy salivary flow. If we don't have that, we have the opportunity for disease to occur. Interestingly also, he talks about remineralization requiring a partially demineralized apatite crystal that can grow as a result of exposure to supersaturated levels of apatite in saliva. So again, what we put into the oral cavity every single day and every single night is going to help the saliva to theoretically repopulate, remineralize, and protect the dentition. Fluoride has been our biggest ally in this event, and goodness knows we have worked with fluoride for countless years to try to help to protect and remineralize and help our patients deal with the onslaught of cavities. However, I had the opportunity back in 2001 to attend the International Association of Dental Research meeting in San Diego, and I listened to the keynote speech by Dr. James Weffel, and he blew me away, and almost everybody else in the room, when he said fluoride is not necessary to remineralize enamel. Calcium and phosphates are. The room was quiet when Dr. Weffel made that mention. And as it began to sink in what he was stating, he indicated that fluoride is an enhancement to the remineralization process. Without calcium and phosphates, the entire process can't occur. So fluoride is an essential ingredient, but it's not the only end-all of it. It has to be part of the entire equation. He said that in remineralization, what we're doing is we're replacing the very, very soluble calcium carbonate and magnesium ions with something that is less soluble, like fluoride. But ideally, the enamel crystals need to realign as they were before they demineralized. And in the illustration that we're looking at right now, as the calcium and phosphates leave the enamel rods, it opens up these spaces in between, which enables the constant attack and the breakdown of the overall fortified structure of the enamel. By placing and replacing calcium and phosphates into the system, those enamel rods can realign, can become stronger, and then if you add fluoride into it, that's how you can prevent the breakdown. But you know what? Once the breakdown's occurred, fluoride isn't going to help us as much. So we need to stop the breakdown before it occurs. In this British Dental Journal article, they talked about the contemporary perspective of the use of fluoride products in caries prevention. And it's a really great article. It comes across with a lot of important information, including that fluoride works favorably in shifting the D and remineralization balance in the oral cavity. And again, it talks about how fluoride is an important component of the entire process. And that it's also most effective when provided at multiple times during the day. And of course, it stresses the safety and the effectiveness of fluoride. One of the materials that I first fell in love with a few years back is glass ionomers and resin-modified glass ionomers, simply because of their ability to have this chemical fused layer occur between the tooth and the restorative material without the need to create a hybrid layer. Hybridization of the dentin has been shown time and time again, especially in recent years, to become a problematic aspect. Even though you and I may use that every day, the formulations of hybridization and the various generations of bonding agents are starting to create some interesting challenges, especially in regards to matrix metalloproteinases, MMPs, which are released from the dentinal tubules when the acid goes on to the teeth in our hybridization level. But that's an entirely different lecture, and we'll get into that at a different time period. But I love it when we don't create a hybrid layer and when we can create this chemically fused layer. There are a few materials like glass ionomer and resin-modified glass ionomer that can do that, and we'll be talking about one of them in a little while. The other very wonderful thing about glass ionomer-like materials is that they don't have polymerization shrinkage. They have an affinity for the overall tooth structure. They love it. And basically, when you restore in the proper manner with some moisture present, not underwater, but with some moisture, you don't want to desiccate the teeth when you're working with glass ionomer because it'll just suck all the moisture out of the dental tubules. That's where your sensitivity comes from when you dry the teeth too much when you're using GIs and resin-modified glass ionomers. You need it slightly moist. You need it glistening a little bit so that there can be an integration to the tooth structure and the absorption of the water from that to help the overall structural work well. So that's another important thing. GIs and RMGIs love tooth structure and do not polymerize away. In fact, as you can see here on these SEMs by Davidson back in 2006, it forms a very intimate structure. And in a previous paper to that, he talks about how glass ionomer showed a continuous integration with the adjacent enamel, and there seemed to be an increase of calcium and phosphorus in the surface layer, suggesting additional mineralization of the material in the tooth structure. So there's a lot of really interesting things going on with these kinds of bioactive materials. They are quite remarkable. Also, they talk about sealant materials that can inhibit and enhance the overall remineralization and reduce mineral loss when fluoride is incorporated into it. But one of our biggest challenges is that many of our sealants and many of our materials don't like water. And they're hard to get into the areas sometimes, and if you don't prep the tooth properly, you may not actually get your sealant to flow into the fissures as effectively as you'd like to. An interesting material, and one of the ones that we're going to be highlighting this evening that was created a few years back, is this Embrace Wet Bond Pit and Fissure Sealant, which is an ionic resin from pulp dent. This material is rather unique in that it enjoys and works with water. It is hydrophilic, moisture tolerant in nature, contains an actual small amount of water, and is water miscible. And you can even mix it with water, as you can see on the lower right-hand side. This material was actually kind of found by accident, as most major discoveries seem to be. They were working with this in lab, trying to find new formulations, and for some reason, when they came to this batch, when they worked with it, they were trying to clean up the glass slabs. They found that it adhered to it, and it formed a lovely integration to the slab. And upon further testing, they developed this really remarkable bioactive ionic resin in this Embrace materials. There's an ionization that goes on here, which is the breaking up of a compound into its ionic components, which makes these Embrace materials very unique. The hydrogen in the phosphate acid group is replaced by calcium that would be present in the tooth structure. So there's an exchange going on. There's no hybridization when you're using this. And as this material works, this resin with moisture, it etches, it ionizes, and adheres to the tooth structure. And in the presence of water, continues to work with taking on, replacing the calcium present within the tooth structure. And this is an ongoing strong resin hydroxyapatite complex, creating a very positive seal against micro leakage in the overall interface between the material and the tooth. And this confocal image of the dentin and the Embrace is reminiscent of the SEM I showed you earlier of the glass ionomer and the tooth structure. There is no hybrid layer. There is simply an interface, a chemical fusion of this material to the tooth structure. Very unique, very, very, very special. And there's no other resin restorative material, sealant material like this, any material that contains an Embrace wet bond resin material. It's also been shown to be antibacterial. In this test that we're done, it actually creates a 4 millimeter inhibition zone around it, just by having the Embrace material and the ion release that it has. It also is able to, this test done by my pediatric dentistry professor, Mark Cannon, when I was at Northwestern. Mark was a great friend and still is today, and an incredible mentor in the things that he's done. And this interesting test showing how even through a disc of 2 millimeters thick, that the sodium fluoride solution into the ionized water still penetrates. There's still a flow without a breakdown in the physical properties of the Embrace material. So this is the basis of some remarkable things that we've been able to use for a number of years in our Pitt and Fisher sealants. It releases fluoride, it recharges fluoride, it enables uptake by the enamel. And yet this resin, when cured, has an extraordinarily low solubility rate of 0.06%. It's not a static material. This is dynamic. It's bioactive with an active and continuous ionic exchange. That's really remarkable. So as you can see in this overall schematic here, our toothpaste, food, and water, along with the fluoride in our toothpaste, mixes with the saliva and basically gets into the Embrace material, releases ions, and protects the tooth structure. Based on the successes with their Embrace Pitt and Fisher sealant, the folks at Pulp Dent developed this Embrace varnish, which has been on the market for a couple of years now. And it's very unique because most of us, when we've been using fluoride varnishes in the office, as soon as you apply it to the tooth structure, if there's any moisture present, you get those globs forming on the dentition. And that's because you're working with a hydrophobic material in a moist environment. And how many times has your patient said, I hate coming in and getting this stuff put on my teeth because my teeth feel worse when I leave than when I came in. The Embrace varnish is one of the varnishes out there that you don't have to have that statement made to you. It has bioavailable calcium, phosphate, and fluoride. It uses a xylitol coating on these materials that are then in this permeable Embrace resin material that will not separate. If you ever open up your traditional varnishes and you peel open the little tub and you find that little brown layer on top, that brown layer is resin. If you dip your brush into that resin, you don't put fluoride on the teeth. You just put resin. So if you are going to continue to use your traditional varnishes, please be sure to use the other end of your brush, mix it all up first, and then paint on the brush, on the fluoride varnish, to the teeth. But again, you're still going to be working with a relatively hydrophobic material, and you're going to get the globs, and you're going to get people to be saying, yuck. This Embrace varnish is remarkable. It releases 10 times more fluoride than any other leading brand out there. The two leading fluorides in my book are the Embrace by Pulp Dent and Premier's Enamel Pro, which has an ACP formulation, which is very, very nice as well. These are the two top brands when people ask me, what do I like? These are excellent. Both of them work quite well. But as far as an ease of use aspect, the Embrace is the simplest. There's no mixing, there's no fuss, no muss, and it goes on and it's smooth. And it's really, really well received by the patients. It's permeable, bioactive with xylitol, releases 10 times more fluoride than the other brands. It doesn't separate. No mixing required. It delivers a predictable uniform dose and sustained time-release fluoride. Very nice taste. In fact, it has no flavoring. Patients tell us that it tastes like this or that or the other thing, but there's no flavor. It's interesting what the patients will perceive things to be. It can be applied, and it should be applied very thin, no gritty texture, stays only on the teeth, not to the cheek, and there's this wonderful flow of the varnish from the buccal to the lingual surfaces. And for those of you who are worried about dietary situations, there's no gluten or soy-based products included in it. It now brings us to probably one of the most exciting materials that I have worked with in years. This is the Activa bioactive material, both the restorative and the base liner. It combines the key components that mimic chemical and physical properties of natural teeth. It has a patented bioactive ionic resin based on the embraced resin material that we talked about. It has a patented rubberized resin in it based on Pulp Dent's Tough Temp. If you've ever used that, that's a really great temporary material. And we'll talk more about that in a few minutes. And it incorporates a bioactive glass. So this is really the next generation of restorative materials. This is groundbreaking, and the buzz around the world regarding this material is quite remarkable. Just got back from the AADR, the American Association of Dental Research, and there's a quiet buzz going on as far as this material and the accolades that it's starting to receive around the world, because it works so differently than what you and I are used to. So it's rather remarkable. This is the only material currently on the market that the U.S. FDA has allowed the following claims to be used: bioactive resin matrix, bioactive glass fillers, the ability to release of beneficial ions from the resin and glass fillers into the oral environment. This is remarkable, that no other restorative material can really be used and use this terminology in their when they get talked about in anything. It is dynamic with the oral cavity, like nothing else that you've ever experienced. The ionic components are always bioavailable. It's moisture tolerant, permeable ion resin, facilitates the diffusion of the calcium phosphates and fluoride even after curing, just like the original embraced resin material that we talked about earlier. The bioactive glass ionomer material that is aesthetic like enamel, strong like every other composite out there, and tough just like the dentin of the tooth structure. Here are some examples of some restorations that I've done with this material. We have a typical class 2 on the left, an incisal edge break on the middle one, and we're going to take out and create a crown on this fractured tooth. So we restored it with Activa very quickly, very easily, and using it as an anterior restorative, a posterior restorative, and even as a core material to try to help protect. It enhances and it forms a very nice union with the tooth structure, almost indistinguishable. Some more restorations. We've even worked it into very giant restorations up on the upper left-hand side, and cervical class 5s. Really very nice material. Works quite well. So as the caption states there, one filling material with many applications. Now, we were talking about that rubberized urethane resin. The resin is rubberized, giving it a toughness, so it has the ability to absorb stress, dissipate forces, resist fracture. It's very much like dentin does when it works, because the outer brittle enamel is supported by the more flexible and dynamic dentin, and that's what they have created in this Activa. It gives a dentin-like response to repeated occlusal forces and thermal changes. Yet the material is polishable and aesthetic. And of course the easy double barrel syringe and rotating tips make it very easy to place Activa everywhere that you need to work with it. It has high flexural strength, high tensile strength, a moderate flexural modulus, and it definitely has a better deflection rate, high deflection rate. And all of these are important physical properties in a restorative material. When you compare Activa to GI, RMGI, and composite, you can see that it does bring something important to what you and I do every single day. It also has what they call a triple cure formula. It has 3 settings. You can light cure it, you can use it in a dark area of a post area, and it will self-cure. And it also will self-cure via the resin chemistry and via the glass ionomer acid-base reaction. And yet it contains no bis-GMA and no BPA and no bisphenol A. So basically, it doesn't have any of those challenging ingredients that we've seen in so many else of the resin materials that we've had. The bioactive restorative material can be used from top to bottom. I use it in that manner as a dentin replacement, enamel replacement material with the strength and aesthetics of composite, but of course with the great toughness and fracture. And for those of you who want a base liner underneath your traditional composites, the base liner material will allow you to do that. No sensitivity, no crumbling, and you don't need to use any bonding agents with these material. What I do is I just acid etch, wash it off after about 5 seconds, and then place the material in there. And I will build it, cure it, and go from there. So I think we have a group of questions, and we'll go to that in just a second as well. So I've gone through this in a rather speedy manner, so that gives us lots of time for questions. So we'll go through some of them right now. Linda asks, how does its wear resistance compare to other material? Extraordinary. Toughness at the AADR, some papers that were worked on by some other doctors in the universities have shown that its wear resistance is equivalent to the nanocomposites that you and I are traditionally working with. So I've had no problem with that personally in my work with it, and from the studies that were shared with us at the AADR, they were comparable. So that was a good question, Linda. Benny asks, is Activa bonded? No, you don't use a bonding agent with it. We have to get away from this concept of bonding agents with these glass ionomer and bioactive materials. This is an ionic exchange. It will physically, chemically fuse to the tooth structure. So it is not a material that is going to use a bonding agent. And Linda asks, what is the bond strength of this material in vivo? I don't have that knowledge base offhand, Linda. I apologize. As a clinician, I just see what I have, and we have restorations in for the last 2 years that are still placed, many of the ones that we just looked at in the photograph. So I do apologize for not having that information, but I'm sure we can probably get that to you or to those if you were to contact the folks at Pulp Dent. Randy asks, who's the manufacturer? And that is Pulp Dent. They're based out of Watertown, Massachusetts. They are their own research and development lab area. They are continually working on new ideas, and they're remarkable in what they do. Always ask, can it be used to build up material for single unit crowns? Yes, you still want to, of course, have your typical ferrule to make sure that you're not landing or finishing on the material itself. But yes, it's a fine pulp build-up material. That's what I've used, and I showed you in that other slide a couple of minutes ago there. Thank you, Maresh. I appreciate your comment. Let's see, what else have we got? Lots of questions today. This is great. Going back up the line. Nilma asks, Can it be used in high caries index situation? I'm not sure exactly what you're talking about there, but let me do this. If you go in and have a several teeth with caries that you need to restore, I would certainly consider this as one of the materials to use in there as you would a glass ionomer in previous time periods. What this has over GI is that basically it's not going to be as affected by the overall acidity of the oral cavity to the extent that some minor breakdown can occur around glass ionomer because of the type of special resin, the Embrace resin that's incorporated into this. We don't have that kind of separation and breakdown. So yes, I would certainly use it in that capacity. Is Activa radiopaque? Yes, it is. It is very much so. And again, this is just the threshold and the beginning of things, Gary. I think that we're going to start to see, and some of the quiet buzz at the AADR is that the science around the world wants to move away from the hybrid bonding materials that we have seen failures after only 6 years of time as the research continues to evolve. And so I think that we're going to start to see that more and more are going to look at materials like this, because what we've been doing has been okay, but it hasn't been what we need it to be. So I think we're going to see some really remarkable things. I think Pulp Kent has thrown down the gauntlet and has invited the manufacturers and the clinicians and the research facilities around the world to help create better materials, and that's what this pretty much is. Benny S., is the liner necessary? I don't use it when I'm doing my restorations with Activa. I just use the restorative material from top to bottom. But again, some doctors want to use a liner and then put their traditional composites on top of that. I don't do that, but some folks out there do. So that's why that's available. Giovanni asks, just asking about nanocomposites, but you're now speaking of this now. Anyway, seeing this that Activa has two component materials, what is the second one, please? Basically, again, it's a dual barrel gun, so that this way the catalyst and the material can be activated when it's mixed. So that's why it's dual active material. But it has in it the Embrace material, it has the rubberized urethane, and it has the glass ionomer components, the glass fillers in it, which is what makes it bioactive along with the resin material. I hope that helped, Giovanni. Let's see, we've got, what is the cost? I don't have that knowledge. When we buy it, my office manager buys it for us. I know that it's cost competitive to any other material out there, and I'm sure if you contacted your dental supply company, they could tell you what the cost would be. Matthew asks, which material would be best for use as a sealant? Well, basically, as a sealant, you'd use the Embrace sealant material, the Embrace Wet Bond. That's a fabulous material. It flows extremely well, Matthew, and it has that bioactive capability. So that has been one of our favorite sealants to work with, is the Embrace Wet Bond sealant. Elva asks, is Activa another type of reinforced glass ionomer? No, it's something completely different. This is in a category all by itself. It has, as I said, it has the Embrace resin material matrix, it has glass fillers in it, and it has that ability to absorb shock. So this is something very different than you and I have seen to date. And when the company first shared this with me a couple of years ago, when they wanted my input, because they know that I'm a crazy bioactive, biomimetic type of an individual, and when I speak and talk about it around the country, I'm passionate about using materials that are going to help with the restoration and the durability. And when the guys at Pulp Dent asked me to come to Boston to meet with them, it was quite a remarkable meeting of the minds, because they were thinking along the same lines as I was. And when they created this and showed it to me, I was just overwhelmed with delight. And as the formulation has continued to evolve with my input and several other doctors around the country, it's rather nice to work with. So I think that once you start playing with it, you'll start to see that it's well worth your time and effort. Miles asked, can it be used in the cervical abfraction lesions? Well, first of all, I don't believe there's anything called abfraction. I think abfraction is a misused word. It's an erosion. It's an abrasion. My friend Tom Abrahamson would tell you that there's no such thing as abfraction, but that's another lecture altogether. But yes, in the cervical erosions, class 5 situations, by all means. I did show you that in one of the slides in the pictures that we've worked with. Benny's back again. How long does it take to chemically cure? Approximately 3 to 5 minutes if you did it in that capacity. But again, I mostly like curing it. But I know that if I have a deep preparation and I want to bulk fill with this, that I'm going to be able to do that, and I know I'm going to get a cure from top to bottom, Benny. How good are anterior aesthetics? Well, I can go back to that slide for you real quick and show you the aesthetics on that one tooth here. And as you can see, the before and after, Michael, on that middle slide, it works pretty nicely, and you will be able to get some really nice chameleon effects with it. So I've been impressed with it in that capacity too. Madhuka asks, can Activa be used in dry mouth cases as in cancer therapy and cervical buccolingual caries? You know what? That's probably an excellent use for it, because whatever moisture can be present in there, I think, would be enhanced by the release of the ions. So that's an excellent idea. I endorse that a lot. Robert asks, can you use Activa in class 2 restorations? Yes, as you can see on the upper left-hand slide and on the follow-up slides here, Robert, it certainly is done. And here are some other cases that I've done it with. So it's an all-around restorative material. So that's what I found. Let's see. Nilma says, thank you, and I thank you very much too. You have a 16-year-old patient who currently in control, and I would get this for her final material. I'm glad I was able to help. It's a pleasure. That's what I'm here for, to try to share, as I like to tell my patients, my insanity with you all, so that this way you can broaden your horizons and hopefully create better long-term restorations for the people that we serve. Has Activa been around for 2 years? As Embrace? No, Embrace has actually been around for about 10 years or more. One of the interesting things about PulpDent is that they've been kind of a quiet company. They've been, many of the private label materials that you use in your office are actually created by PulpDent. And they've been very quiet up until now. They've decided that it's time to reveal who and what they are, and in the creation of Activa and Embrace Varnish, they're really starting to show that they are a company that can and has really made important strides and important contributions to the dental profession, and it's been a pleasure working with them over these last several years. Sanai asks, when used as a lining material and composite on top of it, yeah, you'll probably want a bonding agent between the Activa and the composite material if you're using a traditional composite. If, however, you want to put more of the Activa restorative on top of it, no, then you don't need it, because it's like materials and it'll be able to work together. But basically, again, for me, I use the restorative material top to bottom. And that's just me. Miles asks, is it available in different shades? Yes, there are several shades. Again, I think that if you contacted your dental supply company, they will be able to tell you what shades are available, Miles. How aesthetic is it? Again, Reyes, in the previous slide, we showed the aesthetics in the middle. So it is quite nice, and it is proven to be quite chameleon. And Rosanna asks about the shades, and yes, and as Michael, there are shades available. You can definitely look online, either at the Pulp Dent site or on your dental supply company site like Shine or Patterson, and you should be able to find the shades available for that. Should curing be done, and Jacqueline asks, in increments? You can work with it in any way that you like, Jacqueline. I bulk fill it because of the triple curing situation. It's going to not only light cure on the upper surfaces, but it's going to self-cure in the lower entity as well. So it actually makes the process of doing dentistry and restorative work faster, more effective, and more efficient. So it's a pretty remarkable product, and I think that you'll enjoy it as you start working with it. Robert, thank you so much for your thank you. I appreciate it. Nisar asks, doesn't come in different shades? Yes, it does. I just don't know that offhand. I apologize. I just call for what I need, and my assistants get it for me, and they're absolutely terrific. Do I use do I have any extra retention in my preparations? Well, yeah, depending on the size of the preparation. If you're doing something really large, like the one in the other slide here, you're certainly going to want to have some kind of retentive capability in there. So I'll put some slots and some grooves into those, like the one on the upper left-hand side. You know, there's only so much that our man-made materials are going to be able to do. Remember that we're there trying to fix the messes that our patients present with, that they really created challenges to. So what we're trying to do is just fix what they do. So yeah, you've got to add retention where appropriate in any restoration. I don't care if you have 30 megapascals, quote unquote, from your hybridization layer. You're still, if the force is just right, you're going to snap that puppy right on off of there. So yes, use whatever your judgment and your appropriate call for action is to make sure that you have enough oomph in your restorations to stay in there for as long as it possibly can. Again, Glenn, check on the shades, and Alfred, check on the shades with your dental supply company. Dina asks, is Embrace opaque or clear? It is opaque, and that's what I like about it, because you can see where it's placed and you can check on it. So it's pretty great. Thank you for your thanks, Maruka. Thank you. Are contacts easily achievable? Robert asks. That's a great question. It depends on how you create your matrix. And that's an interesting concept. When I'm out on the road talking to my various courses that I give, we always talk about matrices and how to create better contacts. And certainly using the right kind of matrix is going to be great. Garrison and Triodent, they make great sectional thin matrix that you can, when you wedge first and then put everything in and you open up your contacts, you're going to be able to get it. So, and you're going to have to burnish your margin and your interproximal area to make your contact. It's the same with any composite material. You have to prepare your matrix well first in order to get your contacts with any restorative material. So great question, Robert. Kayla asks, what is the shrinkage of this material? It isn't significant. Every material shrinks. That's just par for the course, with the exception of pure glass ionomers. They don't shrink. They basically adhere. There is some shrinkage because this is a type of resin material. I don't remember what the shrinkage factor is in there. I apologize, Kayla. I don't have that at my fingertips right now. Alfred asks, how packable is it for a good contact? It is a flowable material. It flows out of the syringe. It is somewhat stiff, but again, you have to create your matrix to create your restoration properly. And that's going to help you out there. Oh, Tom comes through with some answers to the to the shades. Thank you. Activa will come in A1, A2, A3, A3.5, and there are restorative kits according to what I've just learned from him, retails for about $185 or so with the dispenser. So thank you for that information, Tom. I didn't have that before me because, again, we buy it, but I don't know what it is because Karen just sends in the order when I tell her what I need, and she works with the companies to get the best prices. And again, negotiate with your dealers, especially if you're in a larger facility that has a few more docs. It's important, you know, if you can get a break, you should try to do it. Sorry, Patterson and Shine and everybody, but you know, we're all looking to try to make ends meet, and by all means. Paul asks, do I like bendable needles? As long as they allow my material to flow out, yes. If you bend them wrong, you're not going to get material to flow. But with proper, you know, the needle tips on the Activa syringes, I've not had any problem with material flowing. So it's not a problem for me, Paul. Jacqueline asks, 100% isolation is always an issue, so that it is a great product, and you'll try it. Well, thanks. And again, I think you will find it very, very nice to work with. As with any material, at any time, try it on the bench first. See what works with you. And then once you've got a little bit of confidence with it, bring it to the mouth and work with it. Make sure that you understand your materials and how you're working with it, and not your assistant only. We joke about it in the various courses that I give, how the doctor doesn't know what to do and the assistant is there reading the instructions to them as they're doing things. Excellent confidence builder for the patient. So be sure you understand what you're doing before you do it, and how it's going to work in your hands. The restorative material, for some doctors, it does take a lot of oomph. That's why they've created a special dispenser with it, because I asked them to increase the viscosity, because I wanted something that would pretty much stay where I put it, and that's what this does. So for those of you who need the dispenser, use it. And those of you who are beasts like me, you know, 5'5", 3,000-pound beast, you won't need it as much. But you'll find it and you'll figure it out as you go along. So I hope you've had a good information shared with you this evening. I'm glad to have this time. Here's my phone number at the office and my email address. If you are going to email me with questions, please put in there in the title Pulp Dent or the Dynamic Dentistry webinar question. This way I'll get it through my spam blocker, so this way I'll know that you can get in touch with me. And again, please, if you call, ask for Karen. She'll get a message to me, and I'll get to you either during my office hours or after them as I possibly can. I do respond to many of my emails, so I will be able to help you out in a lot of that going on. So I hope this has been helpful to you.